Development Goal number 3, good health and well-being, with a focus on mental health. 5% of adults in the United States suffer from a mental illness each year. Suicide is the second leading cause of death of people 10 to 34 years of age and the 10th leading cause of death in the United States. However, as of last year, more than half of the population suffering from mental health disorders failed to seek professional help due to stigma, high poverty levels, lack of insurance, trauma, and discrimination. In my project, I concentrated on spreading mental health awareness and advocating for better access to resources for people who need help. I invited a speaker, Dr. NhialTutlam of the St. Louis County Department of Public Health, to give a presentation at my school touching on the current state of mental health in Missouri. Through this, students will be more informed and empowered to be advocates of positive change in the mental health care system. During Mental Health Awareness Week, I coordinated a fundraiser at my school in association with the Pattonville International Club, where we sold awareness ribbons during all school lunches. This was done to raise money for Our Little Haven, a nonprofit organization that provides early intervention services for children and families. To spread mental health awareness in the immigrant community, since there are stressors like new environment, culture shock, stigma, fear of deportation, among others. Lastly, I arranged a letter writing campaign where other students and I advocated for free and confidential mental health public booths, similar to the emergency police booths, to be installed in common public places. This was in order to help resources to be more accessible to people with mental health issues. I realized the power of establishing strong connections with my peers, my advisors, as well as the members of the community. For the success of this project, I had to mobilize volunteers from my school to assist with the awareness ribbon sale, the planning meetings, the promotion of the project, as well as the letter writing campaign. I needed to strengthen the rapport with my teacher, Miss Cordy, she's right there, who guided me all the way through my project. It was my responsibility to reach out for help and advice from my mentors. They're also present, right here, to make sure that I was on track. They were very resourceful and informational, an example being Dr. Nhial, who volunteered to give a presentation at my school and also provided informational pamphlets to hand around. For the success of this project, I needed to advertise it. This included having good communication skills since I had to talk to a lot of people, mostly strangers, about mental health. I had to courageously make my voice heard by organizing platforms where I would address my concerns about mental health, like school meetings and the church presentation, because I was advocating for something that I care about. Currently, our society puts less emphasis on mental health than physical health, while on the contrary, mental health is escalating to be one of the top causes of fatalities in our population. I realized that if all of us could speak out and embrace mental health, we would observe a more positive outlook. As I did my fundraiser selling awareness ribbons, I realized that I collected more money from church than from a whole week at school. This made me learn that when discussing mental health concerns, having a platform to speak openly and genuinely about the issues to a receptive audience is more effective than trying to initiate awareness during the rush of a high school lunch. Classrooms to raise awareness in support of the fundraising campaign. I was most fulfilled when I got feedback from individuals who were impacted by my project. Some said and spread mental health awareness. Some said that they were in a better position to detect persons who needed help, and some said that they would focus on tracking their own mental health. I believe these steps, no matter how small, can make a difference. The role we play in mental health advocacy as a community can influence mental health stigma to completely wear off, better and affordable equitable access to care to be implemented, and the passing of more legislation and policies favoring mental health. These actions can help communities achieve Sustainable Development Goal number 3, which ensures healthy lives and promotes well-being for all at all ages. Thank you for listening, and I'm grateful to be part of today's celebrations.